So good morning. I'm LA County Supervisor Holly Mitchell. I have the pleasure of representing this beautiful community in the 2nd Supervisorial District. And we just witnessed a powerful reminder of both the resilience of wildlife and our shared responsibility as stewards of the coastline. Each animal returned to the ocean by the Marine Mammal Care Center represents countless hours of coordination and expertise. And let me just pause and thank the volunteers. Give them a round of applause, please. Who go through hours of training, I'm sure, and just pour your heart and soul into this process. And on behalf of all of LA County, I thank you. It's also, I think, a reminder of what's possible when public agencies, nonprofit partners, frontline responders, and community members work together towards a common goal. And so again, my thanks to LA County Lifeguards, LA County Department of Beaches and Harbor, our coastal city partners, state and federal agencies, and everyone represented here today for your commitment to protecting our coastline and marine ecosystems. I'm assuming the other electeds that are here today are going to be introduced, so I won't do that. I do want to acknowledge the staff of Assemblymember Tina McKinner, who is chair of the LA County Caucus in the legislature. Thank you all for coming. The county has a responsibility to lead, and we don't shy away from that. And we've stepped into that role. Through board action, we've invested resources, we've elevated this issue, and directed the creation of these regional convenings because the challenges facing our coastline require coordinated action. I want to emphasize that the health of our marine environment, the safety of our beaches, and the resilience of our coastal communities, again, are shared responsibilities. I happen to think, and Supervisor Hahn's office is represented. Thank you. I just saw your jacket. I happen to believe in a variety of ways, a regional approach is the best way. We're doing it with La Casa in terms of housing, and I think a regional approach makes sense here too. This is our shared responsibility, county and city, so we all have to step up to the plate. That's why we're doing these convenings, to all be here, to talk about regional strategies, because the reality is the algae bloom that we experienced several years ago, we know will continue. As a result of climate change and global warming, we are living in a different environment. Our marine mammals are trying to survive in an ocean that's several degrees warmer than it has been historically. So it would be naive at best if we assumed that last crisis was one and done. It is not. So the point of these convenings is for us to acknowledge that and to be prepared to talk about what our strategy would be so the Marine Mammal Care Center isn't caught flat-footed and looking for resources after the fact. That's the point of these convenings, and I appreciate you all for coming. We're going to develop sustainable and equitable funding strategies. Did I say funding strategies? Yes, I did. Strengthening regional coordination, sharing responsibility across jurisdictions, and ensuring frontline responders and our partner organizations have the support they need before the crisis comes. I'm emphasizing that for a variety of reasons. It is not that the county is trying to shy away from our responsibility. We stepped up to the plate financially in a meaningful way. I'd like to thank a number of our cities who are represented here today who have done the same. And there is opportunity for additional cities to join us. There is opportunity for additional cities to join us. There is opportunity for additional. Because if we all put our shoulder to the grindstone, it'll make the collective work a little easier. Again, I want to thank the Marine Mammal Care Center for the care you provide. Having come from nonprofit executive management, I know it ain't easy. I know fundraising isn't easy, but you are doing the work we all need you to do. And so I am here today, as well as my elected colleagues, Supervisor Hahn's office, Supervisor Horvath's office. Those two carried the motion initially. I amended it to include these regional coordinating meetings. We're all here as a sign of our commitment and support. And again, collectively, if we lock fins, we can make it work to support your work in making sure that our marine mammal constituents have the best opportunity they can to survive in their natural habitat. Any questions anyone has of me before I turn the mic over? I scared everybody when I said funding opportunity 4 times. Thank you very much for being here, and I look forward to the continued collaboration.
Good morning, all. And thank you, Supervisor Mitchell, for your opening remarks. I am Katrina Love, Division Chief of the Community and Marketing Services Division with LA County Department of Beaches and Harbors. I'm so glad to see all of you here today for the 3rd Marine Mammal Regional Convening. It is our first time that we are meeting in person for the number of times that we've met before. So thank you so much for being here. It's been an eventful morning with the patient release that Marine Mammal Care Center has hosted with Orchette. I've been practicing that, right? Cascatelli and marshmallow being released back to the ocean today. It was heartwarming to see that, and I did watch from the window. I didn't want to get sand in my shoes. I've worked for Beaches and Harbors for a number of years, and I just can't get with the sand, but I was there with you all in spirit and watching from the patio. So I just want to let you all know that, we have a number of things that are planned here for today's convening. Just a quick summary. Supervisor Mitchell has already said, why we are here, just making sure everyone is aware of the purpose, and we will continue that. Our goal is just to be proactive instead of reactive, because the domoic acid event is going to happen again. And we want to make sure we are as prepared as possible. And at this convening today, we'll talk about a number of things, but Marine Mammal Care Center has curated a wonderful panel discussion for us today with experts here, and we're going to talk about the impacts. What are the emerging risks for our marine mammals, and what does that mean for our environment? So we're excited to kind of get into that, but just a quick note, please make sure you sign the sign-in sheet. That's going to be our official record here today for those of you who are attending. So I'll pass it over to Dave for our panel discussion.
All right, thank you so much. Thank you, Katrina. Thank you all for joining us today in person, and thank you all for joining us online as well. My name is Dave. I'm with the Marine Mammal Care Center. I'm going to do a quick introduction to our panel right now. At the far end of the table, we have Tracy Quinn with Heal the Bay. We have Dr. Rivard with the Marine Mammal Care Center, Dr. Michaels with the California Wildlife Center, Dr. Peters with the Marine Mammal Care Center, and Dr. Middleton with the LA Department of Public Health. And we're going to be talking a little bit about, as we said, the mass stranding events that we've had, and also, looking into our crystal ball for what might be coming in the future that would impact marine mammals as well. So that's what our panel's discussion is about. I have some fabulous people with me to discuss all of that, and we're going to start off with Dr. Rivard. So Dr. Rivard, we've had these massive harmful algal blooms recently that have led to mass strandings of marine wildlife. Can you explain a little bit more about what we're seeing and why?
Sure. So what you all may be aware of is the harmful algal bloom event that happened last winter and spring off the coast of Southern California. That harmful algal bloom event was caused by an algae called Pseudonychia. It releases a toxin called domoic acid. And what happens is this toxin bioaccumulates up the food chain in prey items that are consumed by apex predators like California sea lions and common dolphins. So what happens is these animals get a whopping dose of that toxin. What we see most commonly is neurologic disease. So animals that strand on the beach with seizures, lethargy, disorientation. In some cases, they'll die acutely. And also abnormal behavior in California sea lions. So these animals should exhibit evasive behavior. They should move away from you. But in cases when they're exposed to domoic acid, sometimes they'll be hanging out on the beach, approaching people as well. So those are all things that we can see with animals that strand with domoic acid. And they tend to strand in large numbers, as many of you may have seen or experienced last fall. So that can really overwhelm our responders. It can overwhelm our rehabilitation facility and our ability to treat all of these animals at once. And it can also cause a significant public health risk because we have lots of animals on the beaches and lots of people on the beaches. So trying to make sure that we prioritize human safety as well as animal safety and animal welfare when these harmful algal bloom events happen is really important.
So we've had two really massive events in the last 5 years or so, and impacting thousands of animals likely. What do we think about the long-term impacts of these consistent sort of threats to those animals?
Yeah, so it's a little bit hard to say because a lot of the population work and the modeling work that is done, funding to those programs has been cut. But what we are concerned about is the impact that it can have on the California sea lion population long term. We know if these animals are exposed over and over again, it can cause permanent damage to their brain. So that can impact their ability to forage correctly. And a lot of the times they don't do very well with that long-term exposure to this toxin. In addition, most of the animals, especially with California sea lions that we see affected, are adult females who are pregnant. So not only does it have an impact on the adult animal, but it also has an impact on the pup. So we're not entirely sure that impact that's had on the California sea lion population, but we had a lot of California sea lion pups that were exposed last year right before they were born, and that can cause preterm abortion. So these pups are consistently non-viable, and it can also cause the neurologic disease in the pups as well. So we really have some concerns about what that cohort looks like that was born last year and the impact that these recurrent blooms can have on the California sea lion population as a whole.
All right. And we, of course, want everybody to know that if you see a sea lion stranded on the beach, or you don't know if it's stranded or not, you make sure to give it plenty of space. Stay at least 50 feet away from any animal and give us a call at 800-39-WHALE. That's for us to come and assess the situation because the animal may be suffering from, like you said, a chronic DA where it's impacted from previous years and might still be exhibiting some of that behavior. Dr. Michaels, DA doesn't impact just marine mammals. It also impacts lots of other animals as well. Can you tell us a little bit about your experience with DA and how it's affected the California Wildlife Center?
Yeah, so for those of you who don't know the California Wildlife Center, we're located in Calabasas, California, and we service all native wildlife in California. So that includes terrestrial animals as well as marine birds and marine mammals. And so to kind of add on to what Dr. Rivard was talking about with marine mammals, given that this toxin is something that is occurring in the environment and we're seeing it move up the food chain, that means that it's most likely to affect other animals than just marine mammals. And some of those animals that we see in Malibu are marine birds. So many of these birds are fish eating, so they feed on bait fish like anchovies and sardines that consume the algae in their diet, therefore bioaccumulating the toxin. And so when you have these fish-eating birds that then come and eat these fish, they too get exposed to a really high dose of domoic acid. And so while many of us see marine mammals probably as more of a popular or public figure on the beach, believe it or not, marine birds can also serve as sentinels for ocean health as well. And unfortunately, we do often see very similar signs in marine birds like we see in marine mammals. So these animals, these birds will also develop neurologic signs. They'll have seizures on the beach, they'll have tremors, they may not be able to fly away, or they just might be displaying abnormal behavior. So I think it's important to recognize kind of how interconnected the marine web is, and understand that yes, marine mammals are super important and often more noticeable publicly, but marine birds might actually be the first step in seeing that an event is happening. And thankfully to a lot of people in this room right now or on this call, reporting those animals, reporting those birds helps us then to have a better understanding about what's going on along our coastline. And then we can work with our partners at the Marine Mammal Care Center and let them know in case we haven't started to see symptoms develop in our marine mammals. So Yeah, it's really interesting.
And we should mention that California Wildlife Center, or CWC, is a partner with the Marine Mammal Care Center, rescuing marine mammals and lots of other things up in Malibu, in that area, and then Marine Mammal Care Center covering the rest of the Los Angeles coastlines. So great partnership to have. So continuing on this, we've experienced these harmful algal blooms. They're massive. They're impacting everything from, you know, Santa Barbara all the way down to San Diego, and you know, they're a big deal. But they're not the only challenge that we have. Highly pathogenic avian influenza, or HPAI or HPAI, is something that we're worried about right now. Can you explain a little bit more about that?
Yeah, so high path avian influenza, some of you might have heard about it, or some of you might be hearing more about it recently in the news. I'll give you a little definition of what it is. So high path avian influenza is a virus, unlike domoic acid, which is a toxin that's released in the environment. And I'm sure all of you are somewhat familiar with viruses. Having lived through COVID, you understand it's an infectious disease that can mutate over time. And so avian influenza historically was considered a foreign animal disease, meaning it was not endemic in our area or on our continent. It would usually pass through temporarily during the fall or winter when birds were migrating. And it's something that's historically been primarily documented in birds, hence the name high path avian influenza. Unfortunately, over the past 5, 6, 7 years or so, we're finding that avian influenza is becoming endemic to North America and other continents. And so this is obviously concerning because, again, we know what viruses do. They like to mutate. And so as those viruses mutate, it can create more and more problems. As a facility that treats both terrestrial and marine wildlife, we've become pretty trained to recognize what these animals look like. So they too can develop neurologic signs, kind of similar to domoic acid. They can have seizures, tremors, they can be disoriented, but they also tend to develop respiratory signs. And unfortunately, most of the animals that get exposed to avian influenza die very suddenly. So that is kind of a telltale sign of what could potentially be going on. And as Dr. Peters will talk to you about in just a minute, with these viruses that are constantly evolving, we're starting to see not just movement between birds and exposure between birds, but we're also starting to see spillover into other species as well, including mammals. It's also a zoonosis, so it's something that can be transmitted from human or animals to humans, and so there's that public health concern as well. So I think just kind of taking a step back and realizing that we can all share a lot of really important information with one another and share what we're seeing in our facilities is great. But obviously there are some limitations. For example, when you're dealing with high path avian influenza, there's only so much you can do because these animals die so suddenly. And the risk to reward ratio is really high. You have to consider biosecurity for your other patients that are in care, for the staff and the volunteers that are caring for these animals. So there's a lot that goes into it. But I'm going to let Dr. Peters take over and explain to you why this once avian disease is now starting to become really important when it comes to marine mammals.
Dr. Peters. So we know that it's impacting marine mammals as well. Tell us a little bit about what it looks like for marine mammals.
Yeah, so over the past 5, 6 years or so, as Dr. Michaels mentioned, there's been some spillover events from birds into marine mammals. And what that means is that some marine mammals got the virus from some birds, but they weren't necessarily spreading it between mammals, mammal to mammal transmission. It was bird to mammal only. So there's been a handful of those events in North America over the past several years. And those are frequently pretty isolated occurrences affecting, a handful of animals, but not in the thousands, sometimes in the tens, hundreds, but not a huge major outbreak because it's just that bird to mammal transmission. However, those are often associated with, it has a high mortality rate. So those animals do tend to pass away pretty quickly. And then most notably, the one that you might have heard about in the news recently was in Northern California just this past spring. There was a spillover event from birds to mammals at Año Nuevo, which is just north of Santa Cruz. And so that impacted, I think the final count was around 65 or 70 animals that died associated with that event. Most of them were elephant seals, but there were a couple of California sea lions and otters as well. Although most notably also with HPAI and marine mammals, a few years ago, there was a major outbreak that did involve mammal-to-mammal transmission as well. And that was in the southern hemisphere, affecting primarily southern elephant seals, although a number of marine mammal species were affected. And that was a major event. Thousands and thousands of marine mammals died associated with that event. And it affected more of them because there was that mammal-to-mammal transmission. It also popped up at an unfortunate time of year when all these elephant seals were on the rookery. The adult males were there for breeding, the adult females were there for breeding and to give birth. And so that affected many adult females, but also a huge number of pups. The mortality in pups was extremely high. And then also many of those females that did survive left the beach before breeding. So impacts on a couple of years of that population. And I think it's going to take some time for us to even fully understand the impact that that event had on the southern elephant seal population. So, you know, we're very fortunate in this area at this point that we haven't seen an event like that of that scale, but it's possible. And so some things that we have to think about when we're planning for, you know, what's to come and what we can anticipate or at least try to prepare for on our beaches. As like Dr. Michaels mentioned, the signs that you typically see with mammals and birds with HPAI are primarily neurologic and respiratory signs, although the mortality is very high, so you do see a lot of acute deaths. Neurologic signs, you know, are also what we see with DA. So if we had, say, an outbreak of HPAI at the same time as an algal bloom, that could be really complicated for us in figuring out what the animals are suffering from, and especially because HPAI is a zoonotic infection, that has major implications for people who are handling the animals, both our responders on the beach as well as people in the community who are also on the beach coming into close contact with these animals. And then of course also, you know, beaches and harbors and our partners who help us with carcass removal on the beach. That would be a huge thing for us to tackle as a community in terms of keeping the people safe if that were to become a major concern for us. As of now, there have been no HPAI cases in marine mammals in LA County. We're really happy to be able to say that right now. And we're also really lucky to have partners in the public health department because we've been doing surveillance testing for HPAI now in many marine mammals for the last few years. And we're really lucky to have that. Most county public health departments along the California coast are not testing for HPAI in all marine mammals that strand on the beaches. It's really awesome that we have that. And so, you know, I think that while it would be certainly a huge challenge, that events like this and getting the conversations going and talking about how we can rely on our partners to make the most of an outbreak situation are really important.
Yeah, and so we've had these big events, mass stranding of marine mammals with DA, and we worry about the potential for mass stranding events for something like HPAI, which will look a little bit different. It's much more deadly than DA, and the role of Marine Mammal Care Center will be a little bit different in that as well. But coordination amongst all of our organizations is what's critical. One of the reasons why we're here today. And one of the reasons why we've invited Dr. Middleton, because this can be not just an animal welfare issue, but also a human welfare issue. Can you speak a little bit about HPAI and what we're worried about from that perspective?
Yeah, absolutely. And so one of the key messages that I wanted to present with domoic acid, or whether it's HPAI, is that large-scale strandings can quickly become a community-wide response. And things that we worry about are surge capacity and scale. And so it can easily overwhelm our first responders, our field operations, rehabilitation, lab testing, and carcass disposal logistics. And planning for surge capacity is critical in any widespread mortality event. We also have to coordinate with many agencies. So this, as you can imagine, if we have a disease that is transmissible to humans potentially and affecting a large number of marine mammals, is that no one organization manages these events alone. It involves wildlife rehabilitation, marine mammal stranding networks, state and federal fish and wildlife. It also involves our animal control, local government agencies, fishes and harbors, public health, and diagnostic laboratories. An HPAI event would require the same type of coordination system, but with added emphasis on biosecurity and communication and clearly defined roles. As it's zoonotic, and so there is this potential for human health, we would want strict monitoring to protect human health and strict messaging alongside with marine mammal health. Responder safety also becomes very important under these circumstances. So protective equipment is needed for anyone who's responding, safe handling guidance, exposure awareness, and decontamination procedures. In addition, with communication with public health to have symptom monitoring and testing and treatment of any persons who are exposed as well. And then we also have the issue of carcass management, which is a major operational challenge. And so we have to consider that with public health concern as well, and timely removal and reporting and testing are key to this operational goal. And then messaging. It's going to be really important that we have clear and consistent messaging with all of our partners. We want to emphasize not to touch or go near sick or dead wildlife and reporting them to the appropriate channels, as you heard. Surveillance and diagnostic testing are critical tools for us. And so at LA County Veterinary Public Health, we work with our partners to support highly pathogenic avian influenza testing and surveillance in marine mammals, as well as seabirds and other wildlife where appropriate. This information helps us to determine the cause of death and track disease information by species and location, and then response decisions. And then finally, I just wanted to emphasize that this is a One Health issue. One Health is a collaborative and multi-sectoral transdisciplinary approach, working at the local, regional, national, and global levels with the goal of achieving optimal health outcomes, recognizing interconnectedness between people, animal, plants, and their shared environment. And effective preparedness depends on communication across sectors, because in these wildlife systems, they can have implications for domestic animals, including our pets, human health concerns, and environmental systems. So the main takeaway is whether it's domoic acid or HPAI, these events extend beyond wildlife alone and require preparedness, surveillance, strong multi-agency coordination, and clear communication in a One Health approach to effectively manage.
Thank you. And I think that, again, it's re-emphasizing the fact that it's not one organization that is responsible for managing these events and the ones that we see approaching us in the near future. Recurrence of harmful algal blooms that are massive. We have, unfortunately, a little bit of practice in that, and we're building our relationships between organizations to be able to help us with those events, which will help us, hopefully, in coordinating for future events like HPAI. Which we hope doesn't actually come our way, but we want to be prepared for it. So these are some of the diseases that we're worried about in mass stranding events, but certainly we have chronic problems just in pollution that's out there in our coastal ocean. Tracy with Heal the Bay has been responsible for a long time, not you personally, but your organization, for monitoring beach quality, water quality, and communicating that to the public. With the recent fires and the disaster that we've had that impacted you personally, and the runoff that comes from that, Heal the Bay has really taken a leadership role in understanding what that impact might have. So can you tell us a little bit about what Heal the Bay does and how monitoring these sort of chronic things are really important?
Yeah, absolutely. First of all, I just want to say I am so grateful to be here with these ocean heroes that are on the front lines dealing with the devastating effects largely caused by human activity. So thank you all for what you do every day. I know it's a heartbreaking work, but you guys really make such a huge difference. So thank you. Heal the Bay has been around for over 40 years. When we were founded, the Santa Monica Bay was widely known as a dead zone. You'd see fish with tumors, surfers, and lifeguards were regularly getting extremely ill from entering the water. And a lot of that was largely due to the Hyperion treatment plant just down the road here, which was discharging partially treated sewage, about 300 million gallons every single day. And Heal the Bay took action and fought the city in order to get them to invest in advanced treatment. And we have seen incredible improvements in, the wildlife that has returned to this area and in people getting sick a lot less frequently from our waters. But now we are seeing that a lot of the pollution entering our bay, and that's largely what Heal the Bay works on, is protecting public and marine health from pollution, and more recently from the impacts of climate change on our bay. So now a lot of the pollution that's entering our bay is from urban runoff and stormwater. So you can imagine everything within the watershed. Anytime you throw trash out your window or leave it in a parking lot or don't pick up after your pet, when it rains, that all gets washed out into the ocean. And it's not just when it rains, because people wash their cars and they overwater their lawns, and all of that gets into our storm drain system, carrying pollution to our waters. And we know that that is impacting not only public health, but marine health. More recently, with the fires, Heal the Bay, in our partnership with the lifeguards, was able to get out into the water immediately after the fires to try to understand. As some of you may remember, ash was observed coating the ocean surface up to 100 miles offshore during our January 2025 fires. And what we learned in the aftermath is that there was no plan for understanding the impact of that on human health or on marine health. There was no testing protocol. There's no public health standards for what concentration of the types of contaminants you might see in the ocean after a fire would be harmful to human or marine health. And so, we really took the lead on a lot of that. We got out and we were doing water quality testing north of the fires, through the fire zone, all the way down to Palos Verdes. So we had a comprehensive data set. We were advocating for governmental agencies to do that, and our regional board did step up and start taking over some of the sampling, doing monthly sampling through May. But it was largely on Heal the Bay and other nonprofit organizations to deliver that information to the public, to say what is safe and what is not safe. We put together a team of experts to develop risk screening levels for the heavy metals and other contaminants we were seeing in the water, and we're able to convey that to the public. But we also saw that it seemed as though our harmful algal blooms were getting a little bit stronger in the aftermath of those fires. And I think there was a lot of questions coming from the public about whether the fires were causing them. We know that the algal blooms started prior to the fires. But we also know that there is a strong correlation between harmful algal blooms and nutrient loading into our bay. And a lot of the firefighting foams contain phosphorus and other things that can help to exacerbate our harmful algal blooms. But it's not just the fires. It kind of takes us full circle back to Hyperion treatment plant. And science is showing that our wastewater treatment plants are also a large source of nutrient loading out into our bay. And so one of the things that I wanted to highlight, and one of the things we're working on, is the city of Los Angeles, which owns and operates the Hyperion treatment plant, is doing a lot of work and making a lot of investments. They're planning to invest billions of dollars to recycle the water that's coming out of Hyperion treatment plant. It's something that Heal the Bay largely supports. But we also are looking to advocate and would love community support in saying, when you're making these billions of dollars of investment, let's make sure that we're also reducing the nutrients that we're discharging out into the bay, so that we're not exacerbating the challenges that climate change is bringing to our bay. And so, there's a lot of things that we're all working on, and I'm really proud to be able to work together with the Marine Mammal Care Center and the veterinarians and scientists on this panel. But one thing I just wanted to note before closing out is that all of our organizations, our ability to prepare and respond to the devastating things that you see with how domoic acid is impacting marine life, how your health is impacted by entering the water when it's polluted. we do that through donation support. And so one thing I couldn't leave without saying is that, if you care about the work that these groups are doing, please make sure that you are supporting them. The support to all of our organizations is being decreased as attention moves away from science and research, and it's desperately needed more than ever. So please consider supporting these incredible organizations.
Yeah, thank you, Tracy. And I think it's a great point to bring up, in that individuals certainly have the opportunity to support financially, but there's something that everybody can do with support, because we all have a voice, and we all have representatives from, some of them are in our room, from elected offices who have resources that maybe not everybody has. And so talking to your elected officials, making sure that they know that you feel like this is an important thing to invest in, that we should have these coordinated efforts amongst organizations. It's really important to have that kind of public-private partnership that really helps make these things work. So it can happen on many different levels. And there's a lot that we can do. Some things are going to happen to us, right? We know that we're going to have continued nutrient input from the Hyperion until we get that fixed. We're going to continue to have urban runoff until we can get that fixed. We're going to continue to have climate change, but we can lessen the total impacts by mitigating against all of the challenges that come at these animals, our wildlife. Whatever we can do to reduce one of the stresses that they might have, be it from mitigating its nutrients, or maybe working with overfishing, or many other things, we can lessen the total impacts and help these animals out. One of the challenges, though, that we have, and I just mentioned climate change, is we're seeing year after year warmer and warmer waters. And this year we're going to be seeing a super El Nino is what's predicted. So an El Nino, but on a super level. Dr. Varg, we've seen this type of thing before. We had a warm water blob or a marine heat wave. We have one right now as well. What are the types of impacts on our local marine life and marine mammals in particular do we see from these heating events?
Yeah, so these heating events can pose a significant risk to our marine ecosystems. And what we've seen historically is that as water warms, some of the fish or fisheries, especially the prey items that we most commonly see California sea lions eat, move further and further offshore. So that means that moms who are nursing their pups, or pups who are learning how to forage on their own, have to travel further to find food. And what happened with the unusual mortality event associated with the warm water event back in 2015, 2016, is we saw thousands of malnourished, really skinny sea lion pups washing up on our shores all along the coast of California. So a little bit of a different event from either an infectious disease like HPAI, or a harmful algal bloom like domoic acid, is we just get inundated with these sick sea lion pups. So they aren't with mom long enough, because she's usually more depleted. So we see just thousands and thousands, unfortunately, of these really skinny pups that can really put a strain on our resources and on our ability to rescue and respond to all of them. And honestly, just to get all of them fed can be a challenge.
Yeah, and this is something we've seen before, and it seems to be playing out again for us. Right now, in this summer, we're seeing that marine heat wave kind of come up the coast. I think temperatures are 4 to 5 degrees above what they normally are this time of year. And the El Nino, it's going to be warm water this summer, but that's not actually the El Nino. The El Nino is going to hit a little bit later down the road in the fall, winter. And depending on timing, that's going to be a really important issue, right, with when that warm water comes to us.
It is, because the unfortunate thing with the timing is we may not actually see it impact us in our local beaches, because if this warm water event hits in the fall, California sea lion pups are born in June mostly, and they're supposed to stay with their moms for about 9 months. And the largest breeding colony of California sea lions is in the Channel Islands on San Miguel Island. So if this warm water event hits in the fall, in October, when the pups are just a couple of months old, the sad reality is that a lot of those pups probably won't make it to us, because they're not really going to be old enough where they're going to be venturing out for food. And because of our current political climate and a lot of the minimization of sort of that population assessment when it comes to these animals is this may be a significant mortality event for California sea lion pups, and we may never know about it because those animals will be on the Channel Islands and are unlikely at that age, when they're a few months of age, to make it this far and strand on our beaches where we're able to help them. So that's something that we're concerned about as well. Is if this fall and winter comes and we see a lot of stranded malnourished sea lion pups, we'll do our very best to take care of all of them. But it'll also leave a lot of questions if we don't see them, what's going on, because a lot of those programs that are decades long that do that overall health assessment and population assessment on some of these marine mammal populations have been cut, unfortunately. So that's going to be sort of at the back of our minds as well.
It highlights how important it is that we have so many different partnerships, from local municipal governments to county to state to federal. We need all of that support to be able to understand the big picture, to recognize what might be happening out there and what we might be seeing in the future. We need our federal support for that. We need our county support for dealing with the impacts. We need our municipal support also for dealing with those local impacts. And it takes all of us together to really make this all work. And all of us together really are underfunded for approaching the scale and magnitude for what we see coming. So we have a new normal out there, and that new normal is change for what we might see. We're not sure about HPAI, but we see it on the horizon. We know that it's impacted marine mammals. We're not sure if we're going to have another DA event like we've had in the past, but we're pretty confident it's going to happen because of how things are going with climate change. We know that we're going to get this warm water event. How it's going to impact these animals, we're a bit unsure of, but we've seen the past and we know what can happen. So preparing and making sure that we're all ready in a time when it's not a crisis is one of the most important things. And our CEO has brought up, before you don't wait to build a fire department when you finally get a fire. You have the fire department so you can react and respond to that fire. We need the same thing here. We have our partners here who are getting some practice at it, unfortunately, but we still need that more support. So we have our wildlife equivalent of a fire department ready to respond. And that's going to look like more than just one department. It's going to look like lots of different organizations and municipalities working together to solve these kinds of problems. So I want to just ask one last final question of all of us. Considering this new normal, what are some of the challenges that we might see in just coordinating for people? Like, what should people expect to see in the future, and how can people help us to move things forward? Anybody want to take that one on?
I can take it.
All right.
We painted kind of 3 different scenarios of an algal bloom, an HPAI event, and a marine warming event with a lot of stranded sea lion pups. Those are all different, but it's unlikely to be that black and white also. And they all involve basically a bunch of animals on the beaches. And we don't expect people to understand the differences between those sort of events. It's confusing. And I think it just really emphasizes the importance of relying on community partners. If, lifeguards and beaches and harbors have a huge role to play in calling us, calling Marine Mammal Care Center, calling CWC, allowing us to assess the animals and make the best recommendations. We will certainly be taking recommendations from a human health PPE standpoint from the public health department, really leaning on them for that guidance, for testing, all these things. It's going to take everybody together, but on a day-to-day basis for people on the beach seeing animals, the biggest, the most important piece is to keep your distance. You don't know if it's a wild animal that's suffering from an algal toxin, might be unpredictable, or if it's an infectious disease that could get you sick. Keep your distance and call your partners for help, and we can all work together to do our best to figure it out and keep everybody safe, the animals and humans as well.
Thank you.
Oh.
Yeah, Tracy.
I would say education is key. Educate yourself. Learn more about these issues. Educate yourself to keep yourself safe. Heal the Bay has a beach report card app you can download that will tell you near real-time water quality data, so you can see if you're going to get in the water, what the water quality looks like. But also, all of our groups share educational materials on our social media, so share that with your friends and family. Get the information out there. I think if you want to take direct action, there's a lot of volunteer opportunities. At Heal the Bay, we invite you to join us every month for our Nothing But Sand beach cleanups, where we're going to get that plastic, that trash off of our beaches so it doesn't cause harm to our wildlife in the oceans. And advocate. I think Dave spoke to this earlier. We all have a voice, and our decision makers wield a lot of power in the regulations that are set, the policies that are set, and how funding is used. And so, join our groups. I know that we will often share information for ways for you guys to get involved, for the community to get involved. We'll provide the knowledge and the tools for you to advocate for the future that you want to see. And so follow our groups, join our groups, and help to create the future and, the best possible environment for ourselves, our community, and our ocean.
Thank you. John, come to get a microphone. Really quick, John Warner, CEO of Marine Mammal Care Center.
Dave, thanks everyone. We have fire department, lifeguards, beaches and harbor staff in the audience, which I know people can't see. And I think that one thing that I would continue to ask of the public is grace and understanding, because during these events, and I have to say, coming from Northern California 3 years ago to Southern California, people here were amazingly just understanding, really gave a lot of latitude when public expectations might not be met, because we all have high expectations of ourselves, as well as members of the public. And some of these events, animals stay on the beach. They just don't have room. We have no room to bring them in anywhere. That's going to continue to occur until we increase capacity on the hospital side. As you heard with some of these events, they might have to stay on the beach because of disease spread. So we ask people to really understand, take deep breaths alongside us. It's really hard to do these jobs, both on the lifeguard side, the beaches and harbor side, our organization side, if people are overreacting or maybe not understanding some of the limitations, and we're frustrated by that too. We're working on it all together. I know the public has been really understanding, but that's probably the number one thing you can do in moments of stress, is really help all of us by saying thank you, asking what you can do, and understanding that not everything is going to be possible during these moments of emergencies. And that's really a big thing that I'd ask of just our own staff that are facing daily trauma with these things. We want to help them make it a little bit better, not worse. So,
thanks, John. So I'm going to wrap things up here, and I'm going to invite Katrina to come back up. As Katrina is coming up, I want to also mention, because I forgot to do that earlier, Happy World Ocean Day. Recognize there's no S on the end. There's only one world ocean, and they're all connected. And it's one way that we're all connected together is by our ocean, our world ocean. So celebrating today, I think this is a great way to do that. And Katrina.
So I want to make sure all of you have an opportunity to ask questions. This panel of experts has been wonderful, just hearing about all the different things that are involved with these environmental impacts in our marine mammals. So please, if you all have questions, just stand up, let us know what your question is, and we'll have the experts answer.
Then I'll repeat the question. You don't have to hold my. I only make the CEO do that. Does anybody have any questions?
Okay.
In the back.
Yeah, well, I didn't jump on nonprofit self-pay partner facility. I just want to express my gratitude to everyone here. I mean, everyone in this room is so critical. The climate crisis and the biological crisis, they're huge. I'm so glad you're not be reactionary to trying to plan. And so one of the things I heard today, we need to think about how to create self-pay partner help. It's the nutrient building ocean I actually thought about this much before, including the runoff from the yard. So one thing to talk about self-pay parkland is rewilding the South Bay, the California plants. And so I think that's the way we can really help to keep it from getting in the ocean. And so I'm going to think more about rededicating myself to helping get more health coordinators in not just public spaces, but private spaces. And I want to thank Floyd County Harbor Chair, living in a great part of the Esplanade, where we're actually helping restore habitat for the butterfly, which just hit 50 years, right? And come on down to Lush, the ocean blue fly right now. So anyway, thank you all. And let's look at us to collaborate with you all here on the partnership, because as the supervisor official said, we've got a lot of opportunities. Thank you.
Yeah, thank you. Again, it takes a village. So, local coastal wildlife areas are super important for managing coastal wildlife, water quality. All of those things can be supported by having native landscapes, absorbing water before it runs straight off into the ocean, sort of capturing our own water, using it on our own landscapes, and making sure that it's not just running straight out into the ocean. And then supporting local efforts to rewild spaces. Our largest area of possible rewilding is not in a national park somewhere, it's in our own backyards. We have the most space. And so wilding our own spaces is one way that we can really help things out. I did have a question here about testing for HPAI in colonies. Can you explain a little bit more about how we understand what's happening, like with the animals that were in Northern California? I know we can sample them on rescued animals that come into our center. How do we do testing out in the wild?
Yeah. So in LA County, our veterinary public health team, we rely heavily on our partnerships with the animal shelters in LA County. So they may be getting wildlife coming in. So we've done surveillance on wildlife. We also work with beaches and harbors. We do surveillance on seabirds in LA County and with the International Bird Rescue Center. And so we're able to do HPAI, or highly pathogenic avian influenza testing, in these birds and in these animals to understand better what the risks are for LA County. And so when we, for example, have found this in seabirds, then we're able to monitor persons who may have been exposed to them. We're able to provide guidance on what people should do during these circumstances, and then to inform our wildlife partners as well as to what the risks are. As we know that HPAI can spread to other animals, we want to be as vigilant as possible to have these messages.
And in terms of what the testing looks like, kind of on a more logistical level, is that in the Santa Cruz area at Año Nuevo, what that involved is people going out in full protective gear to collect swabs from animals that were on the rookery, deceased animals that were symptomatic, and that was done basically by researchers. UC Santa Cruz has a big presence in that area doing research on the marine mammals in that region, and so they were the ones going out there and doing the actual sample collection, and they partnered with UC Davis to do the testing as well. So another collaborative partnership, but the researchers who are kind of on the ground in that area, it was the same in South America, are the ones that are collecting samples, and so another important component is having those research entities be able to have the resources to do that, to collect those samples, to equip themselves with the appropriate protective gear to keep their people safe as well.
Very cool. Do we have more questions? Yeah.
Is this the same phone number if we birds that might be sick as?
So the question was, is it the same phone number if you see birds versus marine mammals? You can call 800-39-WHALE, and we will forward that information. The International Bird Rescue, if you're in anywhere in LA County, you can call.
And animal control in each individual city is actually the
and
you should call first.
Yeah, animal control in the individual cities as well. And then in Malibu, you can call California Wildlife Center. Yeah.
I have a question on that piece of area. What happens if you're
So the question was, what happens if we see a crossover from marine mammals that have contracted HPAI to people, and there seems to be like maybe a worry that that might happen more frequently. What would our response be? Is that, or what do we do? And how do we treat the marine mammals? So you want to take that first?
Yeah.
Yeah.
Yeah. Unfortunately, so if we're talking about something like highly pathogenic avian influenza, it does have a high mortality rate. And so isolating these animals as best as possible. There may be beach closures under these circumstances. What we'd want are people not to be around the animals. So if there were a giant mass stranding, that would be isolating that area, and only personnel who are trained to be able to go into that area. It would be using proper precautions, basically, as staying away from the animals, calling if you're seeing sick animals in a different area. Can't always control the boundaries or borders of an animal habitat. And so it just would be a lot of public awareness under those circumstances, not touching animals. The destruction of them? No, I think that would be more of getting the carcasses out, because then grouping and having these large colonies, I mean, it just creates a place for other animals to become infected as well. And so getting them out and getting carcass disposal as rapidly as possible would be the highest. Yeah.
Mass vaccination of wildlife. Talk about the challenges, the possibilities of the approach.
The question was mass vaccination of wildlife. Is that a possibility? Anyone want to take that?
Yeah, sure, I can take that one. And so some of our colleagues up north at the Marine Mammal Center recently worked to develop a highly pathogenic avian influenza vaccine for the Hawaiian monk seal, because if we're talking about a mass mortality event like this, we're talking about functional extinction, perhaps in some of these species where there's only 1,000 or 1,500 of them left. So while we can, develop vaccines for some of those species, there's been a vaccine developed for the Hawaiian monk seal for morbillivirus as well as avian influenza, and it was actually piloted and tested on northern elephant seals that were in rehabilitative care. So that's a really great example of how caring for animals in rehabilitation can really make a direct contribution to conservation. So that is possible with some of those Hawaiian monk seals, because there's a lot of resources put into some of these more endangered species. However, vaccinating animals like northern elephant seals and California sea lions that we see along our coast presents a lot of challenges because the population is much larger. It certainly is in a remote area in the Channel Islands off of our coast. So it requires a lot of collaboration and logistical complications. It's not impossible, but it requires a lot of investment too, to make sure that those vaccines are safe and that they're effective. And we also, there's a lot we don't know about the duration of immunity. So if we were to vaccinate animals this year, how are we going to track them down to vaccinate them next year? Because as most of you know, you have to get your flu shot every single year. That's
babies.
Exactly. So that's a little bit more of an achievable task if you're talking about a population of 1,500 individuals. But when you're talking about tens of thousands of northern elephant seals, that can become a little bit trickier to track. Did you have anything to add to that, Matt or Dr. Peters? No. Yeah.
Nope. Questions over here.
No, I just wanted to add. Actually, humans protect the animals too, because this event going from the animal to the human, if you have for community, for example, from your yearly flu shot, could help from that event to prevent that event from happening.
So what was just mentioned is that people being immunized for things like the flu can actually help to limit transmission from people to animals. Is that and the other way around? So vaccinations, they're important.
Yeah, I had a question on the influenza. Is that just airborne spread, or can you get it from fecal matter? Or?
So the question was, how does highly pathogenic avian influenza spread?
Yes. Yeah, so it's respiratory disease, so influenza, but also interestingly, in wild birds, it's in their GI tract, and so fecal contamination can also spread that way.
That would be it. If it transports to humans, humans who've seen the birds should be more. The bigger concern,
yes. Yeah, and they're migratory, exactly, and so that's why we're watching influenza, exactly, because of the migratory birds bringing this along the flyways.
So what was mentioned is that bird poop is probably one of our bigger problems with transmission, because it's a little bit more widespread. Birds are a little bit better at transmitting over long distances. So a really important issue to consider as well. And in the end, I think what's really important is to remember that we want to keep wildlife wild, and that includes animals that are sick or injured. It is very tempting to want to go up to them and to rescue them, to protect them, and we love that sentiment. That's what we want, but we want you to do that at a distance, and then call the authorities, the people who have the expertise to be able to manage a situation. Because especially now with highly pathogenic avian influenza, this is something we want to be very, very careful about. So I want to just wrap us up here now and say thank you for everybody who's joined in person and online. We've had a lot of great questions online. I'm sorry I wasn't able to get to all of them. But I want to say thank you for everybody who participated online. I want to say thank you to our county supervisors, representatives from Mitchell's office, from Han's office. Also, we have, what's that? Horvath's office as well. And then we also have Mayor of Redondo Beach, Jim Light, who is here. We have Dan Murphy on the board, and also representing lifeguards here as well. And did I miss anybody to thank?
We have 2 board members for FFCC.
Yeah, Dan and Chris, board members of Marine Mammal Care Center here as well. So thank you all for joining us. Thank you for joining us online. This it has been recorded, and we're going to share that out as well. So you'll have this to watch over and over and over again. Thanks, everybody. Segundo is here representing and which one? Assemblyman Tina.
We weren't going to let this convening go by without acknowledging you. We're going to wait towards the end.
Did I jump again?
So the list is shorter. So also we have representative here from City of Malibu. So thank you so much for.
Now I can officially close. Thank you all.
Thank you.